Thank you for coming to the 2021 February safety meeting. Our vision, we will deliver the best customer experience with industry-leading safety, reliability, and innovation. What does it mean to you? And what part do we play in achieving this vision? Julie, what does it mean to you?
To be professional in what we do and handle each and every customer to the best of our abilities with patience, kindness, understanding, guidance. What else?
And of course, safety.
Yes.
Okay. Overview today. During today's meeting, we will be covering right turn and pedestrian as well as ADA sensitivity and wheelchair securement. Our injury topic this month is strain and sprains, back safety. We will refresh ourselves around the fundamental of recognize how to make safe right turn, practice safe driving technique around pedestrians, provide excellent customer service for ADA passengers, and also avoid sprain and sprains and prevent back injury. Fleet safety, part 1, right turns and pedestrians.
Hi, I'm Tres Martinez, and I'm a trainer for bus operators in the public transit industry. Before doing this, I was a driver for over 15 years. One thing that I discovered, and other operators have discovered over time, is that the right-hand turn is one of the most dangerous things that we encounter every single day. Some of the hazards that a driver can encounter while making a right turn are both fixed and non-fixed. You could have a car. You could have a telephone pole or a light pole that's too close to the curb. You can have moving objects, such as pedestrians that will be distracted with a cell phone or maybe some headphones. You'll have bicyclists, a number of other things moving through an intersection that you've got to be aware of before, during, and after you execute that turn. So let's do this. Let's watch this video, get more into right-hand turns, and how you can do them perfect every single time. Not all intersections or right turns that you'll come across can be performed in one fluid movement. This particular intersection is one of those. As you approach an intersection, your work begins before you get there. You have to be scanning the whole time. You're scanning for bikes, pedestrians, cars, fixed objects such as telephone poles and other obstacles that could get in the way. Remember, you're going to rock and roll. You want to use your mirrors the entire time. Remember that your tires should be placed to the outside edge of the left curb to allow for more room to clear the right side object. By going to the left side, it allows more space for that back right tire to clear the obstacle because it's going to follow in the pathway of the tires that are in front. Notice here as the bus moves into the turn. The length of this bus at 40 feet long cannot clear both the left curb and the right curb at the same time. You're going to have to exercise pivot points. By doing so, this bus will go straight to where the driver is actually sitting on top of the curb. Right before that tire would hit the curb, move the wheels in the front to the right in order to avoid contact. You never want to make contact with your tires on a curb because it can damage the tires, it can jostle the passengers, and maybe even knock a passenger over if they weren't holding on properly. As those tires move to the right, you're looking to make sure that the right tire is now getting closer to hitting the curb. And now you want to move those wheels back straight through the intersection so that the right tire does not hit the curb. Once that's no longer an issue and that back tire will clear at that pivot point, turn the wheels to the right again to finish the navigation. You signal that you're coming to the intersection, you scan your mirrors, you rock and roll again, and you enter the intersection and bring yourself up to speed at a gradual level. At this intersection, you'll be using your 4-foot reference point so that you can line yourself up perfectly to make that turn. What is the 4-foot reference point? The 4-foot reference point is what you can set up for yourself on a particular bus to know that you have enough room to make a safe turn. You do so by parking the bus, measuring 4 feet, finding an object on that bus that lines up with the curb. Use that while you make the turn and it will never lie. For this intersection, The operator is going to use the right-hand side of the windshield wiper as their 4-foot reference point. As with any intersection, before you get there, your work begins. You want to scan that entire area. When you come to the complete stop, you want to look to the left, to the right, and the left again. You'll pull slowly into the intersection. You never want to burst into an intersection in case somebody runs a stop sign or a red light. Watch as the operator uses a slow, safe speed while turning. The slower you go, the more room you have to make your turn. You want to use the push-pull turning method. See that the right-hand tire has now cleared the curb, and you straighten the bus out. You must continue scanning and using a gentle, safe acceleration speed, safely enter the flow of traffic. While it's not a right-hand turn directly, approaching a stop is one of the most dangerous and most common things that bus operators do. As you approach the stop, you want to use your right-hand turn signal to show that you'll be accessing a stop. As they get to the bus stop, they turn on their 4-way flashers. This shows vehicles that you are stopped. When you're ready to enter traffic again, you want to turn your 4-way flashers off and have your left-hand turn signal on to denote to traffic that you are moving back into the lane. Scan your mirrors. Slowly accelerate, rock and roll, safely enter the flow of traffic. This bus stop has a fence. It's an elevated stop that comes out from the curb into the lane of traffic. At this location, with this fence that goes along the stop, you want to be careful that you don't swing out too far to where you hit a car in the left-hand lane. You also want to make sure that at the back of the bus, your tail swing does not hit a person standing at the bus stop or that fence. Watch this operator slowly leave the stop, stay in the lane, use their left-hand turn signal to show where they are, and move into the lane and continue on. Not all intersections are created equal. You're not going to have the luxury of using a 4-foot reference point on this turn. The lane is too tight. The road is at a crown. This could cause your bus to lean a little bit. By doing so, it'll get it closer to any light poles or any other objects that could potentially be a hazard. Once the bus continues through the intersection, be wary of cars to the left. Be wary of bicyclists trying to get around to the right. Pedestrians trying to run through to the other side, not observing the proper crosswalk laws. Once you get to your pivot point, you want to slowly turn the wheel, watching that back tire to make sure it doesn't go over the curb, watching that front left bumper to make sure you don't make contact with any objects. As you accelerate into the lane, you want to do so carefully and also slowly so that you don't jostle your passengers. Remember that you are the professional operator. You have to drive safe for yourself and for the people around you that aren't doing so. You have to see things around you, and if you use these techniques that we talk about in this video, you will indeed be serious about safety.
I've been a professional bus operator for 39 years. In my 39 years, I have had 0 preventable accidents. You must stay focused. Safety is first. We face as many challenges every day. You have tourists into town. We have non-driving professional people driving. We have skateboards. We have wheelchairs. We have so on and so forth. Well, the only thing you can do is just stay cool and operate. Do your best. Train hard or work hard and make sure everything is safe. I'm Joel Mason. I've been here 39 years with no preventable accidents, and you can too.
What type of a hazard do you look for during a right-hand turn?
Pedestrians, fixed objects.
Lights, other vehicles, right. Everybody answered that correctly. Fixed and non-fixed hazard, pedestrian, that might be distractor over or even bicycles or other vehicles in the intersection. Good. Where do your front steer tires need to be for this type of turns?
I think the question is before you turn or after, because initially they're going to be pointed right at the curb.
Right on the curb. Which side?
Left.
will be on the left side, correct. So your front steer tire should be placed as far, okay, to the left without rubbing on the curb, so you can give a pat for your rear wheel can follow without hitting the curb or any obstacle on the right side. Be sure you scan your mirror and rock and roll in your seat. What is the 4-foot reference point?
Something on the bus that lines up with the curb.
Okay. It's a predetermined place on your bus, right?
Mm-hmm.
Okay. You're used to line up with an external fixed object to position your bus 4 feet from the curb. Good job. For example, windshield wiper.
Mm-hmm.
What fundamentals should follow to clear your path prior to executing a right-hand turn?
Rock and roll.
Well, you always come around the wall.
So,
Left, right again.
okay.
Make sure you
Cut square turn.
So look left, right, left, and scan the
And
intersection for
make sure your
pedestrians.
speed is
on
under
both
the
sides.
limit.
Right. Right turn is what?
3.
1 and 3?
1 to 3 and 3 to 5 on the left.
Good, good. So that way that you don't jostle your passenger while you're making that turn. And we're going to cover part 2, ADA sensitivity and wheelchair securement.
Welcome to the ADA sensitivity video. As professional operators, we have a lot of responsibilities that go beyond safely driving our vehicle. One of the most important responsibilities is the care and service we provide to our passengers. To a person who uses a wheelchair or other mobility device, a trained and empathetic driver makes a particularly large difference in their quality of life. The ADA requires the delivery of good customer service to individuals with disabilities. Each transit provider shall ensure that personnel are trained to proficiency as appropriate to their duties, so that they operate vehicles and equipment safely and properly assist and treat individuals with disabilities who use the service in a courteous and respectful way, with appropriate attention to the differences among individuals with disabilities. 49 CFR 37.173. In this video, we will discuss communication, providing good customer service to customers with disabilities, putting the person first, and the how may I assist you concept. Effective communication will help reduce confusion and is a key part of your success as a professional operator. Communication will enable us to do 2 things. 1, it will obtain information that allows us to safely assist the customer without violating independence. And 2, help us develop a trust factor between the professional operator and the customer. If every action is communicated and approved by the customer, the possibility of misinterpretation will be limited. Communication with the passenger also allows you to gather information such as, is it the customer's first time using the service? Be sure to keep your conversations professional. Here are some communication tips to use. Greet passengers and inform them of your bus route and destination. Be willing to repeat the information and break information down into smaller pieces. Speak directly to the customer, not to their companion. Speak clearly with a normal tone and speed unless the customer requests otherwise. You should never ask what the person's disability is. It's not appropriate. If they speak about it on their own, then respond politely and be courteous. If the communication becomes challenging, maintain your professionalism and remember these tips. Continue to create a welcoming environment. Treat adults as adults. Use simple words and short sentences. Repeat information if needed. Illustrate or visually demonstrate what you're asking. If you do not understand, don't pretend to understand. Ask another way. Do not use sarcasm or exaggeration. And have patience. Providing good customer service to your customers with disabilities is the right thing to do, but is also a requirement from the ADA. Here are 10 tips to follow. Be patient, establish eye contact, and approach the passenger with a smile. Treat customers with disabilities with courtesy and respect. Use person-first language. Persons with disabilities are customers just like everybody else. Give customers with disabilities the same information and choices that you give other customers. Never make assumptions about your customer's physical or intellectual abilities. Never hesitate to ask a person's preference. Ask customers if they need assistance. Do not assume. If they say yes, ask them how you may assist. Take no for an answer if they don't want assistance. Do not touch customers or their mobility devices without their permission. If you are asked to repeat or write what you said, do so calmly and pleasantly. If you don't understand what the passenger is saying, just ask them to repeat, again, calmly and pleasantly. Be patient and allow customers to take their time. Respond in a calm, professional manner. What does it mean to put the person first? A person who has a disability is still a person just like anyone else. All of our passengers are people first. When you say disabled person, you are focused on the disability first. But when you say person with a disability, you're now focused on the person first. When we think about a disability, we think about someone that is not able to do something, and that's not always true. When you look at the word disabled, if you knock off the D on both ends, you're left with is able. People with disabilities can still do many things, and we must remember to always put the person first. Next, let's talk about how may I assist you. Don't assume anything and never hesitate to ask a person's preferences. Always ask how may I assist you or how can I guide you. Let the passenger decide what kind of assistance they would like. Here are some things to consider. Introduce yourself and ask, how may I assist you? Or how can I guide you? Pay attention to what the passenger says and act on what they want. Take no for an answer if they don't want assistance. A passenger should never have to ask for assistance, because the operator should always ask first. A mobility device is considered part of a person's body and should not be touched or moved without getting permission first. Once you get permission, let them know what you're about to do before you do it. When securing the posy belt, let them know and ask them to lift their arms. They have the right to say no to the posy belt under ADA rules. Remember to trigger your drive cam camera and document if needed. Finally, don't assume you know best and always ask what type of assistance you can offer. Listen close, be respectful, and follow these tips. Be polite. Be patient. Communicate properly and make sure you both understand each other. Use proper handling etiquette and procedures, especially if they're blind and have a service animal. If they have a speech impairment, be patient and tend to their specific needs. For people using a mobility device, it is vital to remember how to correctly fasten wheelchair securements in an accessible van or bus. As a driver or attendant, you have received the hands-on instruction on how to achieve effective securement. Never allow yourself to take a shortcut. If you become distracted, take a second and pause, and start the process all over again from the top to ensure you went through the entire procedure. Do a quick check to ensure it's fastened appropriately. We hope you found this information helpful. Our jobs face us with different challenges every day, and if we perform as the professionals we are, we will always provide safe transportation and excellent customer service.
So what are some good communication tips you use with customer?
First, introducing yourself, letting them know you'll be performing their trip,
Okay.
and ask how you may assist them.
Okay. Greet your passenger. Be willing to repeat information and break information down in smaller pieces if they don't understand you. Okay. Speak directly. Speak directly to the customer. Thank you. That's a good one. And also speak clearly with normal tone, slower speed, unless the customer requests otherwise, okay? Make sure they understand you and you understand them, so you guys, both of your clients and you are a team in the bus, so make sure the communication is strong. What does it mean to ask, how may I assist you?
It's also the same as how may I guide you?
That's
Some
right.
people need arm, some need people up, some people need to lift down.
Right, so pay attention to what the passenger says and act what they want. Take no for an answer if they don't want assistance. Always walk beside them at all times, even though they refuse assistance. Be polite. Be patient. Communicate properly and make sure you both understand each other, and also use proper handling etiquette and procedures, especially if they are blind or have a service animal. Please don't pet a service animal, okay? It might just bite you. If they have a speech impairment, be patient and tend to their specific needs.
Welcome to the Mobility Device Securement video. For people with a mobility device, it is vital to remember how to correctly fasten securements in an accessible van or bus to mitigate the risk of a tip-over or a passenger injury. As a professional operator, you are responsible for the safe boarding, securement, transport, and deboarding of people who use mobility devices. As you are servicing your customers, keep in mind that securing a passenger in their mobility device requires you to be in their personal space. Be very respectful when securing the lap and shoulder belts, and always ask for permission before you touch the mobility device, begin to move or secure it. There should be 2 securement tie downs for both the front and rear of the chair that will help you utilize the 4 down and 3 around tie down procedure. Also remember that not every mobility device that passengers use will be the same. However, all have similar characteristics and must be tied down and securely fastened. The 4 down, 3 around tie down procedure indicates that you must place the wheelchair or scooter in a proper location in the vehicle where appropriate tie downs can be anchored with brakes locked. The 4 down indicates that you must always ensure a full 4-point tie down when securing the mobility device within the bus and strive for a 45-degree tie down angle when possible. You will have 2 securement straps for both the front and rear of the mobility device. Wheelchairs will be strapped down on all 4 corners with 4 securement straps. The 3 around refers to the seatbelt securement of the passengers while sitting in the chair. Effective securement of the passenger increases his or her safety. Both lap and shoulder belts are necessary for proper passenger safety. Make sure the belt is not twisted and the lower section rests comfortably across the hip area and the shoulder belt is set properly over the shoulder. Communicate every action beforehand. Sudden movements can be alarming for any customer. Speak clearly with a normal tone and speed unless the customer requests otherwise. If you are asked to repeat or write what you said, do so calmly and pleasantly. 3-wheel mobility devices and power scooters have other factors you will need to consider. As a professional operator, ask him or her to transfer to a seat and the empty scooter should be secured. However, in accordance with the ADA, if the passenger wishes to ride in the scooter, you must allow him or her to do so. Although this is permissible under the ADA, explain to the customer that it's not safe to do so, and you'll be happy to help assist them to the seat for their safety. If they ask to stay in their scooter, the 4 down, 3 around securement procedure should be used. Power scooters will be strapped down with 2 straps in the rear at a 45-degree angle, and the front will utilize a webbing loop with 2 straps to achieve a 4-point tie down. Again, if they choose to stay in the mobility device, you will secure the passenger with a lap belt and shoulder harness. Here are the guidelines to follow for the 4 down, 3 around securement procedure. Allow the passenger to position themselves onto the securement block. Unless the area is too tight for them to maneuver, they are unable or ask for assistance. Center the mobility device between the floor attachments and set the brakes / power down the mobility device. Attach front and rear securement straps, 2 in the front and 2 in the rear. Attach the straps as high on the chair as possible, but no higher than the seat. The ideal angle for securement straps is 45 degrees out from the chair frame. If using a cam locking system, attach the front straps first to the solid junction of the wheelchair frame. Rear straps should be attached to the solid junction of the frame, just below the seat level on a basic wheelchair. Rear belts should be parallel with the rear wheels or slightly flared out. Front belts should flare out slightly for lateral stability. Route each strap in a straight line. Do not bend it around a wheel or other object. Do not attach the securement straps to the wheels or any removable parts of the device. For example, armrests or footrests. Do not attach securement straps to the folding cross brace of a standard wheelchair or armrest brackets. Use the webbing loop straps provided to you to secure devices where there is not an obvious place to set the hook around. Tighten all straps, but do not over-tighten. A ratchet-type tightener could easily bend a standard wheelchair frame. Always test the mobility device to be sure you cannot move it more than 2 inches in any direction. When in doubt, always contact dispatch or your supervisor. If a passenger refuses to allow application of a restraint device, the driver shall record and document refusals by calling them into dispatch. Also, activate the drive cam event recorder and verbally state the passenger's refusal of the restraint device. If you have any questions or are in doubt, contact dispatch. Remember, as the professional operator, never take a shortcut. If you become distracted, take a second and pause, and start the process over again from the top to ensure you went through the entire procedure. Do a quick check to ensure it is fastened appropriately. Before you get back in your driver's seat, double check that your passenger is secure. The safety of our passengers is the most critical aspect of our work, and the securing of wheelchairs and other mobility devices on our buses are some of the most important activities we perform on a daily basis. We need to make sure we are securing mobility devices and mitigating the risk of a passenger injury.
What does 4 down, 3 around means?
Using 4 tie downs for the chair itself and the 3 securements for the passenger.
Okay.
Only 2 if they refuse the shoulder strap.
Okay. Well, they can't really refuse the shoulder strap unless otherwise it's noted on the tablet or your manifest. I only know, when I was driving, I only know 2 people that refuse that. And if they do refuse it, guess what? Turn on the drive cam and said refuse shoulder strap. And of course, that's the monkey called dispatch. Okay?
Unless it's already in the system.
Unless it's already in the system, yeah, and then you don't do anything else. And if it's in the system, don't argue with them, because that's why there's the comments. You gotta read the comments, okay? 4 down means to always ensure a full 4-point tie down when securing a mobility device within the bus and strive for a 45-degree tie down angle when possible. The 3 around refers to the seatbelt placement. Effective securement of passenger increase his or her safety. Both lap and shoulder belt are necessary for proper passenger safety. Make sure the belt is not twisted and the lower section rests comfortably across the hip area and the shoulder belt and set properly over the shoulder. Now, we have talked about, they talked about scooters, all right? The scooters, if they transport, if the passenger transports to a different seat, of course, the scooters are only going to get a 4-point tie down. But if they stay on the scooter, and then now they receive a 6-point tie down. That's the floor tie downs, okay? And of course, they get the 3 around. That's the belts, okay? Any question? Okay. All right, let's move on to question number 2. What are some important things to remember when securing a passenger that uses mobility device?
Allow the passenger to center the device, make sure the brakes are set or the chair is powered, or the mobility device is powered down.
Power down, there you go. That's a good way when you have to instruct it to power down your wheelchair and scooters, because sometimes they're always in a hurry, okay? Mobility devices are part of their personal space.
Never touch.
Do not touch, you're right, do not touch. Customer mobility device without permission. Scooters and power chair, please don't touch them. Okay, the only time you're gonna ask permission is if they're already on the lift and you just need to place your hand on a part of the wheelchair, scooter, or power chair, just in case there's a motion or change, okay? Do not hold or lean on the wheelchair or mobility aid except when necessary to move the wheelchair. Wheelchair, you have full control of the wheelchair, okay? Ask the customer how may assist him or her with their mobility device or mobility aid. Wheelchairs and other mobility aids are individualized. Do not make assumptions about how they work. Be sure to watch for customer loose clothing and the position of their legs, feet, arm, and hands to avoid injury while operating the lift and securing the customer wheelchair. We always tell them to, when we put them on board or take them out, we always ask to tuck their shoulder or elbow inside the wheelchair. Okay, because the reason is the arm of the lift has that bump stop. And you know what happened if you forgot to tell them to put their arms or elbow inside the wheelchair, they will hit that. Okay? And they will hurt themselves, all right? So be aware of that. All right, part 3, strains and sprains. So what are some risks of lifting? What are some risks?
Back injury.
Back injury, shoulder injury, okay? Many of us may not have the same situation when dealing with lifting a heavy objects, but always remember to use proper lifting technique and always ask for assistance. Or use team lifting when trying to lift something heavy. Never try to lift heavy object by yourself. So, as we know, we have clients that's probably weigh a lot on a wheelchair. We always have for assistance, okay? Don't strain yourself by pushing it. Always ask for assistance at all times. Okay. Minimum 4 bags. Okay. 10 pounds each bag. But we know a lot of those clients goes to where? Costco. When they go to Costco, guess what happened? They buy bulk. When they buy bulk, now it's heavy. Call a supervisor to help you out, okay? Usually, supervisor will transport that client with that big parcel of food. How should you practice safe work method when lifting?
Use your knees.
Yes, bend your knees when lifting and lift with your legs to take the strain off your back.
Know your limits.
Know your limit. And also keep the load close to your body. Okay. Don't use jerking motion. And also don't bend or twist at the same time. And keep your back straight and don't pivot your feet. Now we all secure wheelchairs. Don't bend while you security. Always squat. Okay. Practice good ergonomics.
And also, we talked about clients going to Costco once a month. I always ask them, do you have somebody on the other end that's going to assist you when you get home?
That's correct.
Because they get to an apartment complex and then all of a sudden they're like, okay.
Right. And most of the time, some of those people live on the 3rd floor.
Yeah.
And some people, their main entrance is in the front. So, yes, call your dispatch.
You don't go up 3 sets of stairs. You have to come down.
Until you put them on the bus, but then now you got them sitting in front of their apartment.
Right.
With 100 pounds of groceries and you didn't.
And that be, let your dispatch know if somebody were to meet them in the front. And also, if it's too heavy, call for assistance, call for your supervisor to assist you. Okay? Part 4, back safety.
Know the facts about back injuries. Back injuries are among the most common type of workplace injuries. Bad lifting technique and poor back posture are not the only things contributing to back injuries. Your physical health and lifestyle also play an important role. Your body balance can be off if you sit or stand in an unnatural position, twist abruptly or awkwardly, or lift something incorrectly. Weak, under-exercised muscles rob the back of its support and increase the chance of injury. Excess weight can exaggerate the curve of the spine and strain the back. Stress, anxiety, and depression can cause muscles to tighten and throw your back into a spasm. Here are a few tips for preventing back injury and maintaining a strong and healthy back. Don't back down on fitness. Cultivating healthy eating habits, regular exercise, and daily stretching will do wonders for your back. Don't stand still. Prevent back spasms by breaking up periods of long standing with stretch breaks, or simply sit down to increase circulation in your back and reduce back strain. Always push, do not pull your load. Keep your spine straight and use your leg muscles to move the load. Remember these safety tips when lifting heavy objects in the workplace. Do not use fast or jerking motions when lifting. Do not bend or twist at the same time when lifting. Keep all loads close to the body. Do not handle loads away from the body. Get help. Most loads should require at least 2 or more people lifting. Use a dolly or a forklift if you can. Lift with your legs, not your back. Don't overdo it. If you have to strain to carry the load, it's too heavy. Never carry a load backward. It can throw off your balance. Look after your back. Prevention is better than a cure.
So what else besides bad lifting technique and poor back posture contribute to back injuries?
Physical health, excess weight, stress,
Good.
Okay, good. Physical health, that's correct. Lifestyle, play an important role on your back safety as well. You can injure your back with poor body mechanics, okay? If your body is off balance by sitting or standing in an unnatural position, twisting or abruptly or awkwardly or lift something incorrectly. If you have a weak or under-exercised muscle in your back, you can rub your back or support, increase the chance of injury. Also, weight can also put a strain on your back. And lastly, personal factors, like Mr. Williams said, stress, anxiety, okay? Depression can cause your muscle to tighten through your back into a spasm. So, what scenarios can you think of where back safety is important?
Security wheelchairs.
Okay, secure wheelchairs, that's right. Why is that? Julie, why secure the wheelchair?
Because if you're not bending with your knees, you can strain your back. If your
Twisting and turning,
feet
going
are
around the security.
going cattywampus
Okay.
and not in line with your body, your shoulders,
Okay.
bending from the waist instead of squatting.
Yes. Always squat. Don't bend. And sometimes fast movement can harm your back. Okay. All right, we're gonna couple couple drive cam, video one.
And just real quick, Ed,
Yes.
we didn't go over complete stop awareness. Do we just want to make a note on that, or? On the first page where it says,
Yeah, complete stop awareness.
I mean, you got vets in here, so we all know, but.
Okay. We'll go ahead and cover that after the videos. Videos, okay. I'm gonna watch that video one more time, okay? What could the operator have done differently?
Go slower.
Slow down. And then
So they obviously come up hard and fast, not in there. When you,
let's get in the middle.
All right, so in this case, what do we do? As an operator, how can we prevent it from happening?
Slow down. And
Slow down? Okay.
look ahead,
Right.
look around,
Scan ahead, right?
Yep, scan.
How far do we scan?
150 feet.
15 seconds. Scan 15 seconds. We all know that there's a car on the left, on the right. What do? Slow down. Change your focus every few seconds. Okay? And of course, when you see a intersection, what do? You slow down.
Slow down.
Cover your brakes and look left, right, and left. In this case, this driver didn't do that. Almost hit a bicyclist. Video number 2. All right, I'm going to play that one more time. All right. so on this second video, operator approaches stop sign and attempt a left turn, which is not really a left turn, it's a right turn. And has to hit the brakes to avoid a collision, setting off the drive cam. What can you do? What about this video? How can you prevent this?
Gotta stop on the line. You gotta slow down.
Stop fully. He didn't stop all the way.
Yeah.
No,
So
4 seconds, 5 seconds.
we know she didn't stop fully. She didn't stop, complete stop, look left, right, left, the rock and roll. Even though the intersection is about past the stop sign. And she didn't stop again to look on the left side. She didn't look left, right, left, rock and roll, and almost got hit by a car that was on the left side. So always scan your environment, always stop at all stop signs, stop light. Always look left, right, left, and rock and roll.